we're really covering our own tails. All right.
Yep.
That's
Again, cover it.
Cover it.
What's up, you guys?
Hey, you guys. Welcome back to Nurse Talk. If you watched one of our videos before, welcome back. And if you haven't, it's your first time. Here on Nurse Talk, we talk about nursing-related topics. We try to gear towards the new grad nurses and the old school nurses and dazzle in a little bit of travel in there too. So if that's something you'd be interested in, like, subscribe, and keep up with us. But today,
We're going to give you 5 ways that you can protect yourself and not be put in a situation like Redonda or Gamey.
Right.
So, number 1.
5 patient rights.
5 of them.
So make sure when you're giving your medications that you're giving it to the right patient, the right drug is given, the right way, so that's the right route, whether it's
oral or
I was gonna
peg
say
tube.
peg tube, right?
Oh.
Suppository. Like, you want to make sure you're giving it the right way, the right time, and the right dose.
Yes. All 5 of these things are very important.
Yes.
Okay, so make sure you do that checklist every time you give a medication.
Right. Number 2.
Speak up if you don't feel comfortable, okay? Don't suffer in silence. Don't just not say anything and say this is just what comes with the field. No, it doesn't, okay? Speak up. Let somebody know in management or whoever you need to know, whoever your superior would be, let them know that this situation, you're not comfortable with it.
Right. One example I would give is like giving a patient an intravenous beta blocker when the patient is not being have telemonitors on them.
Right.
So that's one situation you need to learn how to speak up. Sometimes you'll be in the hospital or whatever your facility is, your patient has high blood pressure or your patient has a high heart rate, you know, their AFib is acting all crazy, and the doctor's just like, okay, just give them 5 milligrams of low pressure IV push. And you're thinking, okay, that's cool, but it's not.
Right.
Because you want to make sure that kind of patient is on the telemonitor and is being monitored as you're giving that medication intravenously.
Exactly, because how do you know the outcome of the medication?
Right.
How do you know that it did help their heart rate?
Right.
You know what I mean?
Or maybe it worked too good.
Right. And put them kind of over where you want them to be. So it's important to know these things. That's why that is a good example.
If you don't feel comfortable,
Right.
if you're not too sure, say something, speak up.
Yeah, I've even had situations where doctors have asked me to do certain things that are out of my scope of practice, and I let them know, like, well, I just say no, basically, and then just get reinforcement from whoever the manager is or something like that.
Right.
Because at the end of the day, when you do something that you weren't supposed to and things go wrong, guess who's going down for it? Exactly.
Yep. So it's this all in the spirit of watching your ass.
Cover it up.
Cover it up. Tip number 3 is report unsafe practices. So some of you guys have a union out there, so these are instances where you are submitting your grievances, or you guys could always report to state regulatory facilities. But if you ever feel like you're put in a situation where maybe the ratios are off, right?
Right.
So maybe they're asking you to work with 7, 8 patients and your max is normally 6. This is an instance where you're like, yo, hold the phone, like this is not something we're supposed to be doing, and you need to reach out.
Though it might not help you right in that moment, when you have a grievance on file, it's then noted and documented that you were not okay with what happened.
Right.
Don't let, the field just bully you into doing different things, or your facility bully you into doing different things that you don't feel are ethically sound, or even some things are just impossible. So make sure that you do report these things.
Right.
And that, like you were saying, the union also is a great resource if you have one.
And say you do report it, right? So say you submit a grievance, or you submit it to the regulatory board. If something were to happen on that shift, you're covered, because you literally walked into the situation saying, this shouldn't be happening, but I'm going to make the best out of it. I'm going to do what I can. And if something happens, you already put it out there that I stated from the moment I walked in here and see what the hell was going on in this joint, that this was not a good idea.
Right.
And y'all see what happened, and this is why. And, you know, and just like she was saying, they will try to bully you into continuing on with these unsafe practices. But this is how you have your I's dotted, your T's crossed, and you are making sure that, you know, you are protected at all times. Your license is protected at all times.
Exactly. Number 4 is knowing when to ask for help. Okay, a lot of times we like to not say anything, try to get it all done. We don't want to tell our techs, like, you know,
suffer in silence.
Right, exactly. And drowned, as we say in the nursing field. So don't do that to yourself. Why would you put yourself through that type of suffrage? Okay,
Right.
Ask for help. If you can't get it all done, get help. Now, granted, you're not always going to get that help. Sometimes there's situations where people just are swamped themselves and they can't help you, or they just flat out don't want to. It happens. But at least you're casting that net to try to bring somebody in to help you,
Right.
and get the help that you may need.
Right. That is so true. So yeah, don't be fearful to ask for help. And tip number 5, and this one is a big one. A huge takeaway that a lot of the OG nurses already know, but have your own malpractice insurance. Now, I know you guys know that when you're in nursing school, they make you get malpractice insurance in order to do your clinical rotations. But make sure as a new nurse, as a regular nurse, as an old school nurse, that you have these malpractice insurances still in place so that when something happens, this is your support system. Because as we saw with Redonda, the hospital or the facility that you're working for can be very swift and quick with severing ties with you and letting you handle your business on your own. You can take the fall, you'll become the scapegoat. This way, at least you know that, say you did act wrong outside of policy, or something did happen where you are 100% at fault, this is an extra boost of support to kind of help you through the system of correction, I guess you would call it.
Right, because even, doctors have insurances and things like that. Like your surgeon, they have insurance because stuff doesn't always go as planned sometimes. Right. So they have this in place, so then that way they have that protection.
That security.
So, exactly. So you're kind of putting yourself in a position where you have that security as well. And insurances are actually not that expensive. So it might be something you want to look into.
Right. I think it's pretty, less than $100 a year. Almost
yeah, it's not much. Not for RNs, it's not much.
No. And then this is any type of nurse as well. We're not just talking about RNs. We're talking about LPNs. Because, Gainey's out here too, where she's dealing with the case. So we want all nurses, no matter what level of education, we want to make sure that we're having that malpractice insurance in place. So we're really covering our own tails. All right.
Yep.
That's
Again, cover it.
Cover it. And that's really the gist of it. These were our 5 tips on what we think it's important to kind of do to help us prevent another Redonda or Gainey case.
If you liked what you saw, hit the like button and make sure you subscribe so you can stay in the know of everything that Nurse Talk posts. And start a discussion, okay? We want to hear your thoughts. What are some ideas that you guys can think of that would actually help prevent you from becoming a Redonda or a Gainey?
Right.
Okay.
And if you already have malpractice insurance, let us know the cheapest one. We're always looking.
Always like a deal.
Yeah, we always like a deal. So let us know which one you got so we can cancel ours and switch to yours. But thanks for tuning in. And we hope to see you guys again.
Yep.
So,
bye. See ya.
Don't inside.